are 4.9 million people in the UK who have diabetes. We know from research that typically they spend about 3 hours every year with a healthcare professional, and for the rest of the time they're managing their condition on their own. And what we found is that most people actually didn't really understand what their test results meant. So we came up with the plan of information prescriptions to be a tool that would enable a clinician to have a really useful conversation in that incredibly time-pressured environment that we know a diabetes consultation is.
I think it's vital when we are talking to any person living with a chronic condition that we get their engagement, get their buy-in about the condition. It's important for them to feel that they're in control of it. So a document like this gives them a prompt. It tells them, okay, these are things I can do that can change the outcomes for me.
So one of the challenges that we're seeing in Manchester is that we have quite a low literacy age amongst our population. So the information prescriptions are ideal in the fact that they've got the pictorials. It's ideal that we're not trying to send somebody away with a great big booklet full of information. It's just all there on one A4 piece of paper.
One of the things about diabetes is that it's a huge problem already, and it's growing. And as it grows, the amount of chronic health, the ill health burden on the NHS increases. And it's not always about giving a medication. It's not always about just seeing someone and talking to them and then they go and that's your job done. More and more we see patients really needing to have care packages.
The information prescriptions gave people ownership of their diabetes. So we had feedback from people saying things like, I'm going to get a folder to keep these in. People talk about putting it on their fridge with a magnet so that they think about it when they go and open the fridge and make choices.
It also gives the clinician prompts. So what do I need to discuss with the person living with diabetes? When you see blood pressure, I need to let them know about reducing salt intake, their diet, lifestyle, etc., weight reduction, all of that enables. So it gives them small pointers for us as well.
For me, it's just the fact that we can now give consistent messages. If you do a Google search around diabetes, you will get so much conflicting advice. So it's great that it's focusing people on looking at verified information.
Working with EMIS on this has really enabled us to kind of scale up our ambitions, like actively targeting the patients at higher risk. And I think the other thing was around the support that EMIS has given us, getting that message out to busy GPs, busy practice nurses. Anecdotally, we're hearing some really exciting things about the information prescriptions. A practice in Glasgow did an audit looking at the number of patients who were hitting their HbA1c targets, and they found a 10% increase in the number of patients hitting targets. In Manchester, they were particularly looking at patients who had diabetes and kidney disease, and they found that after the introduction of the kidney disease information prescriptions, they managed to get all their patients off contraindicated medication.
That whole array of ways of imparting information and opening doors for people to access services and get the best for them is really at the core of what we do as a company. So the evidence is great, and we want more of it, and we want to do more of it, and we want to do more types of prescribing in the future.